recording script that I'm going to share because Zoom has now a script, somebody AI that is doing that. So I'm also going to do it. This is just so that you have a lot of things you can go back to for whatever we'll be saying in this session. That's it. So I'm going to now share my screen and then we are going to look at what we have today. I'm very excited about this and I hope you too are going to find it worthwhile your time. So, please let me know once you see my screen. All right, can you see my screen now? I guess so. Hello? Is my screen legible? All right, I see thumbs up, so I guess that is a yes. Okay. All right, guys, so let's roll. So, generally, I'm going to give an overview of how we are going to be working. The course has a format. I think I mixed the slides, but let me see if this is already your results. Good. So, all right. So this is the course overview, right? This is how we are going to be working. I'm just reiterating this. Probably it was not very clear in the introductory session. But what I want you guys to note is that in this course overview, you would always have something to do, something very small to do before the lecture so that you get some energy, you get the forte of what we are going to be doing. And then we'll have live sessions like this, and they are going to be online, just like what we are having now. And at the end of each lecture, you will have an assignment, a to do, something that is going to ingrain, and this is basically contributing to the paper, whatever we're going to achieve at the end of these 12 weeks. At the end of the course, you would have also end of course tax, which is basically the outcome of the entire course. And we'll have awards, best paper, best article, whatever, best participating person, and so on and so forth. So the quizzes, it's not an exam. It's really for us to help you, is for us to help you store, retain, and make sure the knowledge is easily applied. So you would always have quizzes before we start a session, and that is always going to come 24 hours before the session because it helps us know how deep we should go in each session and if and when we need help and where exactly the students need help. So that is the reason why you had a quiz. So that's it. Thank you all for taking the quiz. For those who did, unfortunately, just 5% did. So you guys are nine of you. So we have five. So that is still above average, which is good. And our session is research. This session today is really 101. So it's really to introduce you to what research is all about. And then focus on systematic reviews, which is what we're going to be doing for the next 12 weeks or for the next 11 weeks, counting this one as week one already. So that's what I want you guys to pay attention to. And that's all we're going to be doing today. But before we go, I shared with you guys a video to watch on what evidence-based practice is, a short document that I wrote up so that you guys understand what various methods are and so on and so forth, and then the quiz. So this is all in your document, the course curriculum. I'm going to show that again to you guys shortly, but it's very important, excuse me. But that's what we did. So for the quiz, for the five people that took the quiz, we have just I would say the highest score is 6, the median score is 4, the worst score is 4, I guess. So most people were scoring around that. So um it's okay. It means that we have some work to do to show that people need to know what research is all about. But we're just going to go through the questions that were asked. So these are the questions that were missed. One of the reasons for this is the way you guys answer, it's the way you write things. But I want you guys to know that all of you guys are either medical students in training, pharmacists in training, nurses in training. And what I want you to pay attention to, it's attention to details. a comma can kill a patient. So a comma on your script is as important as that. So that's what I want you guys to pay attention to. These questionnaires are modeled, so they're trained on algorithms. So if you don't put it exactly how it's supposed to be, it's going to mark you wrongly. But that's it. With that said, pay attention to that. It's also something that is very important that we, particularly Cameroonians, don't pay attention to, and it makes us lose opportunities internationally. That's a sidetrack. But question 10, it's where most people failed. And the reason was that when we look at your answer, somebody writes randomized control design, and that was not the instruction. The instruction was clear. Simply write primary design, separate it by a semicolon, and then do the same thing. That is it. And that's the instructions, but people did not follow it. And in the script, it's also written that write the answer in this format. For this person would have gotten the correct mark because he or she rewrote everything and then gave the correct answers and then did that as well. But all we needed was just the answer, just the answer, just the answer. So this person definitely would have had the score. But that's what I just want to pay your attention to. And then the next question was which is an analytic or an analytic observational study. So these are the two correct answers. And yeah, 5 persons selected cohort studies, but I mean, you needed to select both of them to score everything. So again, guys, every session we'll be going through the questions like that. So bear with me. But we're not spending much time here. The next was a which one stands in the hierarchy. I'm just so surprised that people are still confused between systematic reviews and and randomized control trial, which is okay. Still, systematic reviews are on the top of the hierarchy, and that's what we said in day zero to say that that's why we are doing what we are doing. The next was filling the blank space. Yeah, I was just not so happy with you guys because this is where paying attention to details and instruction is important. Bias in a study, selection bias, confounding, the stress of people going to the hospital to see a person. This was something else. So, but again, this is for fun, guys. This is just for us to laugh. There's nobody's name there, but again, it's just for me to understand what happens. So exactly what I want us to pay attention to here, the question is the process of randomly allocating participants to an intervention group in a trial is to primarily reduce. So the correct answer here was typically selection bias. But again, this person did well, but what we needed was a capital letter at the beginning. This person would have gotten a correct answer if the person wrote selection bias. So again, that's what is very important for all of us to pay attention to. So again, guys, keen attention to details. Somebody wrote it there with an accent aigu. Again, pay attention to details. If you're writing in English, write in English. If you're writing in French, write in French. So that's it. Next question is which study design is generally considered the most reliable primary study? And yeah, again, this is a randomized control trial. So those who said case study and the rest, I really don't know, but yeah. And last but not the least, fill in the blank space. Which of the following measures outcome at a single point in time? I expected everybody to have this, but yeah. So cross-sectional study is the correct answer. Again, yeah, it was quite open. We didn't want to make it very hard for people, but you need to type it exactly. And in the questionnaire, I gave you guys hints like orange, okay, something like that. So you should write the same way that it's written. So guys, really follow instructions. Failing to follow instructions is how you fail already. Not necessarily because you don't know what you know, but because you didn't write it properly. And again, if it's a system that is being used, your paper is going to be discarded before the human reviews it. This is why I'm doing this so that you guys get acquainted to how things are done in a good standard. So that's it. Again, the quiz was just for us to know how deep we should go and how light we should go. But from this, I would let you guys, and if you read the primer that was sent to you guys and everything, this will be very easy. The quiz will be a no-brainer for everyone. But that's it. So I said this earlier already. For our course, we are going to have pre-work live session and then end of course tax. I want us to really look at the course program. And I'm going to share with you the document I believe everyone has access to already in this lecture. Um, Let me switch to that. I want you guys to really, this is like where if you are in doubt of anything, you should go and look at it. If you're in doubt of anything, all of us have this document. It's called SRAMP, which is the mentorship program, the curriculum, and that's it. It's a table. It's where everything that we are doing is going to stay. This is where I post everything. And I updated this on the 22nd of December. So here you have the link to this Zoom call. So I'm really not very happy when people write that they don't know where the lecture is taking place, and you have all of that. And you have your milestones and you have instructions. And you also have instructions. Read through, click on the hyperlinks to access all documents. For first time users, you need to request for access. So that's it until you've done it the first time. And so I saw some people requesting on this document for the first time last night, which I mean, this thing has been there since last year. So these are things that were deposited for the live session we had on the 20th of December. And all of this research frontiers, mentors pre-course, mentee pre-course, these are all documents that you should have access to and look at it. And we even have a selfie and we have a record in there. If you click on this link, you're going to be redirected to the folders. And if it's your first time, you have to request access. And I am going to grant you access to that. For this lecture, this is where we are. You had your lecture plan, which was shared with you how this lecture is going to go. I believe most of you read it already, but if you didn't, we'll have the time to go. You have this, which is a simple primer. It's a simple document that I wrote up, which just summarizes everything about research for you. And then you have even an image that was generated that you can also look at. And then we have the video that I said you guys need to watch and the quiz. And then now we've also written a glossary that you can have access to, so that if you doubt or what is it, what is a cross-sectional study, you just go there and look at the definition and you read it. As well, you can Google it. But I mean, we are making all of this available so that you have an idea of it. By the end of this lecture, I want you guys to watch this video because it's from Cochrane, which is where we learn about systematic reviews, to just learn about systematic reviews. But that's it. Again, this is where I want everybody to always look at it anytime. Check on this document. Again, this is the timetable I've updated just this week. By mid this week, you will have everything you need for the 17th. It will be updated. And so, like I said in the emails, this is going to be updated as we go, and the contents are going to be shared because we are generating original content, and so you will have it here. Again, like I said, do not share anything. Um, if we are going to value this course for its cost, it's going to cost you a lot. But again, this is a lot of work that we are doing in the background to make this available to you. I hope that you value it that much. But that's it. I've shared with you this document. Everyone should have access to it. If by chance anybody doesn't have access to this document, please let me know. So let me just ask this now on the forum. Is there anyone who doesn't have access to this document? Mentees. You can put thumbs up, you can turn on, you can just, if you have access, just say yes. Or drop in the chat, say yes. I need everybody to confirm that they have access to this document. Hello guys. I feel like I'm talking alone. Hello, 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 hello. Can you hear me?
Yes, dog, we can hear you. We have the document. Oh, I have the document.
All right, Patrick has the document. If you cannot talk, please drop in the chat. I know some people are on call, but drop in the chat. All right, I'm going to stop that and let's go back to the lecture. But this is very important. I just had to stop and share this because I know it's where everything happens. And if somebody doesn't have it, then the person would miss things, which is what I don't want. All right, so let's get back to let's get rolling. Let's get the ball rolling. So yeah, so that's it. Um, everything. everything is on that document, and really I will not be happy if somebody misses information. It's also very important for you guys to read your emails. Your emails are very clear. I really take time to write them as simple as possible and to really say, do this one, two, three, so that you understand what you have to do. It's not just a blank email. So read them, read them, please. Um, so at the end of the 12 weeks, so in March, generally the first thing is to pay it forward. So every mentee here would be thinking of two other mentees who would uphold our values of honesty, humility, discipline, and productivity. That is if you make it to the end. So we need people more with these core values and not just people who are nice. That is it. You're going to give us a 1 minute video of your experience with us, a one-page summary of your experience, and an HD picture. Some of you, I asked for your HD, we asked for your HD pictures already. Some of you sent selfies and iPhone images. Please, it was very clear in your document. Go to a studio, make use of a photographer, let him take you an HD shot. This is what you're going to use professionally. I cannot overstate the importance of it. If you when you're idle, you can just use me as a model, put my name and see what my HD picture looks like. And you'd see it's very important that online you have that face that somebody will know that, okay, this is somebody I can talk to. It's very important. People say looks don't count, but it really counts. Some people will not talk to you just by looking at your profile. So work on that. And that's why we're trying to build this. If we have your bio, we put this already online for you. If somebody asks you, what are you doing already? You can already share that, and it's online, it's on the platform. That's it. So pay attention to those things. That's why we are doing this for you guys. You might not understand its value, but believe you me, you're going to see its value very soon. At the end of the lecture, at the end of this session, so if you're paying it forward, you recommend two mentees. We will need you to revise your CV and send to us if you want to join our network of researchers. And the idea is really that you're going to join us in rendering services like data collection, data analysis, data cleaning, and all of that. And also keep doing projects. At the end of this, we're going to have a publication. I mean, you don't complete this without a manuscript. That is the goal. You don't complete this without a manuscript. And so we hope that by the end of this, you're going to deliver on that, and then a draft abstract. And so the idea is that at the end of this all, with your abstracts, we're going to look for conferences that you guys can apply to, and all of that and all of that. And so this already gives you visibility of places where you can go with your work. And you're not just saying that I'm passionate about research, but you're actually showing your passion. You're showing, you're not just telling. So that said, enough with the introductory. We have awards that we are going to give you guys. We're also going to give you a certificate of training. But again, what's most important is the manuscript and the abstract. And so we're going to see how you guys do well to get your awards and all of this. So this is what happens in the end. Um, just some housekeeping. I'm just going to ask anybody that is on my screen to read what is on the screen here, just so that I'm sure that people are not sleeping. Darren, can you hear me? Darren, please read the rules on the screen.
Okay, Doctor. Rules and regulations. The forums are strictly for the purpose the academy is serving. Lectures are controlled by the lecturing mentor. The page is allowed only for discussions of this forum. No adverts here except for the academy. And everyone is allowed to ask questions during the Q&A. Feedback after each class is mandatory.
All right. It's very important that you know that feedback after each class is very mandatory. Thank you very much, Darren. Next slide, it's a little bit charged, but I'm going to ask Kelly to read the first three bullets.
Rules and regulations. Failure to follow instructions will get you removed from the forum after 3 warnings. All lectures and support materials shared here should not be shared without approval from the academy. Rated and reread your post, and do corrections before sending in class.
All right. Thank you very much, Kelly, for reading. This is very important with our WhatsApp group. So again, I don't want people writing and slating things and read everything you want to share, and we don't share any other thing apart from what we're doing here. All right. Next person on my screen is Bryant. Bryant Kent. Can you read the last three slides? Last three bullets, sorry.
Okay. Space out your text or short messages for legibility. Use bullets for clarity. Avoid repeated short messages which are all in the same line of thought. Endeavor to summarize all you wish to say precisely in a single post. Inquiries of personal interest not in line with the lectures should be addressed in box to the provost or designated mentors. If the provost or designated mentor deems it necessary, he shall share with the group.
All right, thank you very much, Brian, and welcome to class. So you haven't missed much. We've just been doing housekeeping and also Shane saying that we need to get going seriously with the work we have to do. We shared the quiz. You're going to watch the video and see how you guys did during the quiz, and then a little bit of housekeeping. And thank you for reading the instructions. So that said, we have goals for today. So we've done with housekeeping, and now let's talk about today's goals. And I'm going to ask Afai. Afai, can you read the goals for today?
Okay, doctor. Explain the major families of health research methods. Distinguish primary research versus evidence synthesis. Describe the evidence pyramid and what makes evidence strong versus weak. Identify common threats to validity, bias, confounding, chance, and poor reporting. Draft a first-pass research question appropriate for systematic review in brackets PICO PEO.
Thank you very much, Afai. So this is what we're going to do today. All right. It's not going to be long, and we're doing that at a very high level. Yeah. So thank you for reading, Afai, and let's make progress. So the session is going to be divided into four or three, basically. So now immediately we'll do introduction to research methods, which is going to be quick and sweet. And then we'll have an interactive session. So in the interactive sections, you guys are going to go into breakout rooms. I'm going to send your mentors to follow you there. But the idea will just be to brainstorm on the questions that will be shared, and then we'll come back and have a debrief, and then we'll go back again to the breakout rooms. Those who have their mentors here, you guys can interact, and you can let me know, and then I'll move you guys to the same room. But it's just a session for you to sit down and think. We don't want any conclusions yet. Just sit down and think, but put yourself in that space. So sit down and think and apply what you've learned shortly, and then we'll come back and then we'll have a brief introduction to systematic reviews, because the entire 12 weeks is about systematic reviews. This is going to be a high level summary, and then Q&A, and then we're going to go home. Ideally, this should not take us more than 45 minutes. So already we started 10 minutes late, so hopefully we are still able to catch up. So by 8:30 p.m. we should be 9 p.m. latest we should be done, or 8:45 p.m. we should be done. So it's 7:45 p.m. hopefully Cameroon time. So yep. Good. If you are excited to move forward, please send your reactions on mute and say something before I click the next slide. All right, so why are we here? So we are here because we want to do research, and because research is really how decisions are made from the best available evidence. And the top of on that pyramid is actually systematic reviews. So You today who is on call, you're prescribing paracetamol because some people did research hundreds of years ago to show that that was the best medication or the safest medication for anybody to receive pain meds, unless those with liver injuries, things like that. And they did that. They did several clinical trials, and then somebody in a group called Cochrane came together to put all of those together and say, okay, this is true for it. And that's it. That's why we're starting here. And once you do that for a particular study, you are able to identify that problem where the gaps are missing, and then that informs how new research can be done. So that is important. That's why we are here. And our goal in this mentorship program is really that you build those skills that can generate evidence that would inform policy for a country like ours, Cameroon, and for a continent like ours, Africa. So that's the idea, that you understand how to question on a global level, on a large scale level, on a topic level, what is done, what is missing, and then you go down to say, okay, this is what is missing, and this is what I like, and then I can do something prospective on that. But before doing that, you need to do your homework, and the homework in research is doing a systematic review. Um, that's it. That said, I hope this is clear to all of us why we are doing what we are doing. But yeah, so Lydia, I'm going to make you co-host, please. And as co-host, you're going to be able to accept those who fall out and come in since network is unstable. Please, thank you very much. And yeah,
Okay,
good.
thank you, Doctor.
Okay, good. So that helps me to keep flowing and not get interrupted. Thank you. So that's why we are here, guys. That's why we are here. So let's start from the very beginning. Lydia, since you're on my screen, I just want you to read the definition of the Beltmore definition of research. Feel free to unmute and please read.
Okay, the Belmore's report definition of research: any activity designed to test a hypothesis, permit conclusions to be drawn, and thereby to develop or contribute to generalizable knowledge expressed, for example, in theories, principles, and statements of relationships.
Thank you very much for reading. So this is a definition that I like because it's more comprehensive. It tells you what the various parts of research is all about and why we do it. And the key thing here for us to pay attention to is that we are talking about human research, and we are talking about either intervention. So we're doing something to that thing, or we are just looking at what is happening and how it interacts. So those are keywords to pay attention to. Like 3 months ago, I spoke to all of you and recommended that all of us take the good clinical practice course. And I believe that all of us have finished the courses, but only 3 persons have sent their certificates to me. Please, if you are here and you haven't sent your certificates to me by email, please do that before the next lecture. Why is this important? Good research practice is a misnomer. It's called good clinical practice as if it's a guideline for practicing medicine. No, but it's actually good research practice, and they've been trying to rename it over time. So these are just some principles that all of us need to understand as we engage into research. And these courses are free. You get these certificates, and it's given internationally. And I remember sharing with you guys that if you like the US so much, take the US trainings. If you like the UK so much, take the UK trainings, basically, or you have that certificate so that you can put it somewhere else. And these are documents that, as you're building your portfolio, you can position yourself for research jobs internationally because they'll need to see that. So please, if you have done so, send your certificates to me. If you haven't done so, so I guess 6 more persons need to send their certificates to me because you guys are 9 in number. So that's very important. Now, let's get to what the research ecosystem is. Broadly, we have two classes of research, right? Two classes of research. And the first class that we have here, it's shit. I wanted to annotate, but it's not allowing me to annotate. The first thing we have here is really primary research. And with primary research, what we are doing is really generating new evidence on whatever topic we're interested in. So that's why we say primary research creates data. It creates data. So that's it. And there are ones where you just go and look, so observational studies, and there are ones where you experiment, so you actually do something, so you interact with it. So that's what we call experimental studies. And there are ones where you actually assess, you don't do maths, you just talk to people, listen to them, and know what they are doing, how they go about their day-to-day lives, and that's what we call qualitative studies. And so that's it. And then there's one that mixes both the quantitative, which is these two above, and then the qualitative. So that's what we call mixed methods. Now, when we've generated this data, like everybody now, Cameroon has how many universities? I don't know, but in every final year, you have people doing research. So these people keep doing primary research, and in the end, we have so much data, and then we're like, okay, let's take a pause. What is the data really saying? And so we come now to evidence synthesis. What is the data really saying? We come to evidence synthesis. And so with evidence synthesis, we want to say, okay, 1,000 people in Cameroon have done research. What have they been doing research on? And on what topic? And in that topic, what is it talking about? And that's it. That's what evidence is all about. And that's where we are starting, because we don't want to come and create new data that has already been created. So that will be redundancy. That will be wasting time. So we need to start here and go back. That's why we're starting with evidence synthesis. And the first year on the list is a systematic review. So here you are going to count the papers that have been done, see the topics that have been done, see the trends, and then know, okay, this is where the gap is, or this is what the nature is, and these are the recommendations we can make. That is a systematic review. Now, when you collect those studies, you also have data that comes in. Now, if the studies are very similar, so if they're like children from the same mother, then you get to do what we call a meta-analysis. And the meta-analysis is the maths of a systematic review. And so by math simply meaning that you're going to count and say, okay, these guys were counting the number of people who died. So how does mortality look like in Cameroon, for instance? And that's it. And the next we have, once you've done a meta-analysis, if you cannot do a meta-analysis, if you cannot do a systematic review because the data is so broad and nobody has done anything on it, then we move to what we call is a scoping review. And with a scoping review, just like the name says, it's a scope. So you are going to say, okay, I'm going to look at theses that have not been published, documents that have been written by governments, documents that have been published, and I'm going to put it together and see how wide the discussion on this topic is all about. And that's what we talk about a scoping review. So it's a case where if the data is not really clear, if the knowledge is not really clear with a systematic review, then we are going to spread the umbrella. We are going to say, okay, let's understand the landscape, let's understand the scope of knowledge on this topic, and then see where the gaps are, see where the trends are, and what we can do. Now, if you do one, two, or three, or you cannot do all of them at once. You can either do one, a systematic review only, or a systematic review plus a meta-analysis, or a scoping review. Now, if you do this, now this informs you on how guidelines are developed. So this informs us, okay, a guideline will say, okay, we are going to recommend that people sleep at least 8 hours a day, because we have seen that everybody, all the research done around sleep averages to people sleeping plus or minus 8 hours, plus or minus 50 minutes or 30 minutes. And that's it. And that's how that guideline comes about, because somebody did a systematic review and a meta-analysis, and they put the data together and they say, okay, the hours will be 8 hours plus or minus 30 minutes, something like that. So that's how we arrive. And so this is the research ecosystem. And I'm going to pause again and ask, is this clear? Did I rush this over, or is this clear enough for us to understand on a very high level? Hello, hello, hello.
It is clear, Doctor. It is clear.
All right. I need a second answer. Kelly, Lydia, Afai, Patrick.
Oh, please, doctor, I have a question. Maybe there was network issues, but I did not hear the difference between the systematic review, the scoping review, and the meta-analysis. I couldn't get the difference.
All right. So I'm going to say that again, snappily. So a systematic review, right? We say we take a topic and we look at everything that has been done on that topic. We clearly fix questions for the people we are going to talk about, the type of intervention we're going to talk about, what we are going to be looking into, and what kind of outcome we are looking at. We're going to look at that shortly. Now, a meta-analysis, it's the case where you've done a systematic review and then the studies that you've brought together, they look like children of the same mother. This is a metaphor. So they are very similar. So we can bring the data from those studies and then we can do the maths and say, okay, this is where the average is going to, this is where the effect is going to, this is where all of that is happening. We are going to learn all of that in the weeks ahead. But that's how a meta-analysis adds to a systematic review. So not all systematic reviews come with a meta-analysis. You can do a systematic review without a meta-analysis. But if the data is similar enough, so if they looks like children from the same mother or like Cameroonians, let's use that way, then we can do something that brings it together. That's the first row here. Now, if the data or the study is not that harmonious, if it's not very clear what this topic is all about, then we go to what we call a scoping review. And a scoping review is a landscaping review where you're going to say, okay, I'm going to look at theses that were not published, documents that were published by governments, politicians, and whatever. And we are going to also see what scientists have said. And then we bring that all together and say, okay, this is the landscape, this is the scope of knowledge in this space. And this is where it's missing, this is what is missing, and this is where we can do research on. The idea about all of this is for you to understand what has been done so that we don't duplicate knowledge. And that's why we are starting in this particular mentorship with this assessment of data. And so when we understand the nature of knowledge, when we understand the nature of our meta-analysis of the maths, or we see how broad the data is, then we can then go to this phase where people build guidelines. And so I took the example. Most common recommendations is that people should sleep at least 8 hours a day, So this probably came from many clinical trials that were done. And then somebody did a systematic review plus a meta-analysis because sleep hours is a mathematical thing. And said, okay, we've seen that the average from all the studies that were done internationally and globally, average is to 8 hours, plus or minus 30 minutes, something like that. And that's how they built that recommendation for us to do things like this. So is that clear enough, Patrick? Hello.
Yes, Doc, it's clear. Thank you.
You're welcome. Good. Questions on the chat. Clear, 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 clear. All right, guys, let's ride on. Next now it's research, right? The journey on research. How do you come about really building research? And it's really a journey from uncertainty, right? So you will definitely have a problem. So for instance, let's take for instance, so many people are dying from malaria. That is a problem that is happening. Or we have so many youths being diagnosed of HIV these days, and you're asking yourself, what is happening? So that is a problem. That is an uncertainty. You are not sure that it is the number of people who are dying from malaria have increased or not. You are not sure whether the number of people being diagnosed of HIV is increasing or reducing. So it's a point where you are like, but I'm uncertain about this. So that's where we say we start from clinical uncertainty. All right, we start from that uncertainty. And now we start asking the question, what can be done? What is the problem? What exactly is the problem? Is it that it's increasing or reducing? Or if it's increasing or reducing, what is behind it? So you keep asking yourself, why? What is the problem? And so that is the first phase in the research journey. You need to ask yourself what the question is. So you come from that uncertainty. I don't know. Is it increasing? Is it reducing? Are more people migrating out of coming or coming in? Things like that. And so with this uncertainty, no, 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 no. This is not what I want to do. You guys have seen my slides ahead of time, but it's okay. It's not an exam. But with these uncertainty, so for some reason I can't annotate, which makes it a little bit annoying because everything I'm doing is just next in the slides and I don't like it. So I like you guys to see my annotations on the screen. But let me see if I can fix that. Excuse me. Mm. All right. Can you guys see my ink now? Yeah, I guess you can see it. All right.
Yes, doctor.
Great. Nice. Good. So we generally start from a point of clinical uncertainty, like I said. Lydia, can you admit those who are knocking the door, please? But we generally start from this point of uncertainty and we ask ourselves, what is happening to our people? And you're there and then you progress to, okay, what is really happening? Is it that people are increasing or they're reducing, or what is really the reason why we have more people? And then with that question in mind, now you say, okay, but how can I do this? How? How?
Excuse me, doctor.
Yes.
Um, please, I'm not able to see their request. I'm not sure where exactly to access it. Okay, let me see.
You can see that somewhere, right? Basically.
Okay, okay, I've seen. It's okay. Thank you, sir. It's
Right.
okay.
Great, 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 great job. Thank you. Good job you're doing there. Great, nice. So sorry for that. And wow. So let me recap on this slide. Let me take us back. So we started with the point where you think of something, right? And then you ask yourself the question of the uncertainty that you're. And then from there, now we have to think of the methods of choice. How do we assess it? Do we do a clinical trial? Do we do an observational study? Do we do things? So, but generally, when you have this uncertainty and you have a question, you want to first of all find out, has anybody done what I am looking for before? And that leads us to what we are doing here, which is really a systematic review. So, because when you ask yourself, have people done that? The best way to find it is to go through literature and identify it systematically. Now, whatever method of choice you choose for a primary research, as we're going in this direction, you're going to deliver results. And then, based on your results, we are going to synthesize the results. And then we are going to have a decision. Now, same thing for systematic reviews, all what we have is that instead of us going to the lab and collecting data and going to see all the people talking to them about HIV or about hypertension or all of that, we are just going to say, okay, what is the research that has been done, papers, what do they say? Are we going to do a systematic review only, or a systematic review plus meta-analysis, or are we going to do a scoping review, because that is our focus here? And then we are going to say, okay, what do the results say? And then we synthesize it and we make a decision. So for us, we are not looking things at the primary level again. We're looking things now first, add the level of the evidence that has been generated on a particular topic. So keep thinking on the topics you're reflecting, so the things you like. I shared with you already the frontiers of healthcare that personally as SRA we like topics around digitalization, topics around use of technology in healthcare and so forth and so forth, and in public health. So if you love infectious diseases, bring the use of technology in infectious disease and you definitely find something new on it. So that's the idea, and that's how we keep you keep building and brainstorming how you move from a clinical uncertainty, from a problem that you've identified, to really identifying talking about a new research and generating new knowledge on that topic. I hope that was very clear on that slide. Any worries, any challenge on this particular slide on how you should the thought process, because this is where the hard work is. This is where you're going to think. This is what we want you to do. This is a skill that you're going to build. It's nothing else. There's no right or wrong answer. It's actually building skills, a skill that is going to be able to be assessed over time. So good. No challenge. Thank you, guys. So our next thing now is, how do you choose the right method? So here I'm doing this for every research type, both primary and secondary research. So what I need to pay is, what is your question? Whatever question you have in mind, you ask yourself. Is your question assessing prevalence? Okay, is your question assessing prevalence? Prevalence means the number of people with a disease, something like that. Again, in the glossary, you have this. In your primer, you have this. So you have all the documents to go and read to clarify if there's any term that I'm saying that is unclear to you. And again, number of people having a disease at a time, the causes, things that cause people to die or things that cause people to have. So again, this is where we have a cross-sectional study, and then you have a case control study as well. But again, in cross-sectional study prevalence, you can also have a what we call a comparative cross-sectional study, and that attempts to give us the causes of a particular pathology. So this is one thing that I did in my MD thesis, which was trying to do a kind of a causes, but by comparing it at the level of a cross-sectional study. So this is a very nice way to do research when you don't have a lot of resources. And then the proper way to assess for causality or for causes, it's really looking at what we call either a cohort study or a case control study. And yeah, generally, I'm going to go back. There's the next slide that is going to elaborate on this, but I'm just going to highlight here. Cohort will look in the future, and then case control will look in the past. That's just what I'm going to say here. That is very clear for all of us. And the same thing. And again, if your question is really assessing, does the treatment work, or does same thing work? Ideally, case control might fit there. I think this is not accurate, but the best is really to do a cohort study or a randomized control trial to see if something is working or not. So I'm going to correct this image in the slide I'm going to share with you. But here it's really, the core here is really doing a randomized control trial. Does something work? It's an ROCT, right? Does it work? It's an ROCT. That's the best source of design. So that's what we do here. And then in some cases, if you have money, you will do a cohort study because you follow people over time and see. But again, ideally, it is an ROCT. Now, when we want to understand why and how things happen, you need to talk to people. So this is where we do qualitative studies, and that's where you have interviews, focus groups, and all of that. Now, this is not our focus, so I'm just highlighting it so that all of us understand the various methods. So cross-sectional studies gives us prevalence of a particular study. So this is very important. And if you are very ambitious like some of us, you can do what we call a comparative cross-sectional study where you try to have two subgroups at a particular time. And that can give you an idea of causality, but it's not the gold standard of causality. Causes, this is where we look at really the main causes is where we do cohort studies where we follow people over a long period of time, and then case control study where we stand and then we look back in the past. And then does something work or not? It's an intervention that we need to do. So we give them a drug and we see if it's working. And ideally, that is a randomized control trial. So that's it. The next, it's we want to know why and how people are doing things the way they are doing it. And so next year, it's really what we call qualitative studies. So we talk to them. And to our focus, what we are really going to be doing in the next 12 weeks or so, it's what does the evidence say at all? What does it say? And so that's where we do a systematic review. So the method says either a systematic review only or a systematic review, a systematic review and a meta-analysis if the data is very harmonious, or we do a scoping review if the data is so broad or it doesn't even exist and we don't know what the topic is all about. So this is where we are going to decide for all of you your questions, how we are going to end up in the next 11 weeks or so. So are there any questions on this slide? So no questions. So this is a graphical thing that this slide is probably like 6 years old now. I designed this slide in 2019. So I really like it. So I always bring it back to most of the lectures, but observational studies, it really gives us a good way to summarize everything. So if we take time, right, and we draw a straight line here, this is time. Let me use which color is not on this screen, so then, yeah, red. So if we take time and we draw a straight line here, if we go back in time, anytime we're going back in time, think of case control studies. And anytime we're going forward in time, think of cohort studies, right? And then if you are at that point in time, it's a prevalence study, so it's a cross-sectional study. So that's it. So one point in time prevalence study. So we're going back. So for case control studies, you identify people with a particular disease, so people with cancer, and then you compare them with similar people who do not have cancer. And then it's always good for diseases that are very rare. So that's why I'm using cancer. And also it can give us an idea of what causes the disease. So it's really causality. And when we are going in front, we look more of common diseases, so a cohort study, so we can follow people and see if they develop hypertension, for instance, for a period of time. And so we take people that are smoking, who are obese, and we follow them and see, because those are people at risk. And then we see if a particular risk factor, for instance, obesity or smoking, can cause heart disease, for instance, something like that. And so it really also gives us causal relationship, and it reports the incidence, because when we are following people over time, we see new new cases appearing. So this is a very nice visual that you can also use to solidify observational studies only. So yep. Now, evidence pyramid, this was in your quiz, and we see that systematic reviews is really at the top. Yeah, and again, it really doesn't mean that systematic reviews are the best, okay? The systematic review is only good if the studies that make up that included in the systematic review are good. That's just it. So a systematic review is only good depending on the amount of study, the nature of the studies that it's included in that particular study. Okay. And it's not just the study, right? The methods, how good did the researchers do the studies? Okay. And are the results reliable? So those are things that will affect the quality of the systematic review. That's why we have an entire session dedicated for assessing quality of the studies that we would include. And to be fair, the most important thing is that we need to report all of those things, so that it also makes that what you are generating is worth quoting. So that's it. That's just what I'm highlighting here. So high level quality does high level on the pyramid doesn't really necessarily mean it's high quality. So hope we remember that. But then, like I said, studies are based on really the quality. And I would say that systematic reviews depend on the studies that are included. And we ask ourselves, what really makes research trustworthy? It's really the absence of bias. So bias here, most of the times when they tell people bias, we think that it's really something that you do intentionally. But most of the times, bias in research comes from what we call a systematic error. So by virtue of the way you collect data, by virtue of the way things are done, there is something that happens that prevents, it makes most of the populations included in the study do not represent the true population that you are. So just by virtue of how you sample your participants. And so it's not something that you did intentionally, but probably because you didn't have the good knowledge to do the correct sampling, we got those errors and so on and so forth. So that's it. Confounding are variables that can mix the effect. So for instance, we are assessing people that are going to have diabetes per se. And so if we ignore the fact that these people are obese, if we ignore the fact that these people are eating a lot of sugar, you understand? Those are possible confounders that can increase the risk in a particular group. So in this case, at times you hear the word adjustment. So we try to balance those confounding factors in between. And so these are things that make, when there's confounding, when there's bias, it makes research really challenging. So all what you're doing is try to reduce these things, but there's always some degree of it. And again, chance always happens, right? Errors always happens, mistakes always happens. You can be sleeping on that day, or you quarrel with your wife or husband and things don't work, and then there's a random error, or maybe the Okada man that was carrying from your house in Makepe to the university in Douala spoke to you rudely, and then you got there and then you could not do your research properly. And then the most other important thing is reporting. So I already shared with you guys a Prisma template, and I'm still going to show you guys short at the end of the lecture. We are going to follow the reporting guidelines for systematic reviews, and we're going to try to follow them out to the letter. So that's just it. If you don't report something, we will not judge it. So and what is not reported is not done. That's basically it. So we will try to be open as much as possible, and this is what makes our research really. If you highlight how you mitigated bias, how you try to handle confounding, how you follow the guidelines of reporting, people would look at your research and say, okay, bro, okay, sis, this is trustworthy. We can trust your findings. But that's it. Now, are we all together?
Yes, doctor, we are.
Yes, Doctor. Yeah.
Good. So I can see that we are how many of us on the call now? So this is the first part of the first exciting part of the day. And I'm going to ask Afai, can you read for me the what is on the screen? Afai, you're unfortunate. You just appeared on my screen.
Okay, doctor. Match each question to the best study design. Number
Mm.
one, how common is hypertension in adults in Boya?
Mm-hmm.
Number two, does SMS reminder improve antiretroviral treatment adherence? Number three, what barriers stop women from attending antenatal care? Number four, what does the literature say about telehealth for diabetes Africa? Outcomes in Africa.
Thank you very much for reading. So I'm going to split the entire call into groups, into breakout rooms. You had the experience doing the onboarding meeting. So I'm going to do that, and you guys will have 5 minutes to discuss these 4 questions. Please take a screenshot of your screen now, because once I send you guys into the breakout room, you might not see this screen again. So I'm going to be doing that in the next 1 minute. So I'm going to do it randomly. And currently we are how many on the call? We are probably like 14 on the call. So I'm going to create 4 groups. One, and the idea is that everybody answers the question, attempts all the questions. So we'll have 3 to 4 people in one room for the next 5 minutes. So guys, see you shortly. You should receive an invite now to join your room. And I'm going to move some people if I see that there are only mentors in one room and only mentees in another room. Hello guys, join your room, join your rooms, join your room. Welcome back, everybody. Um, do we want to share our answers? I want one person from each group to just say what their answers were. Uh, hello, 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 hello.
Um, Hello, doctor. So
Yes.
I was in a breakout room with Kelly. So
Mm-hmm.
our answers for question one was a cross-sectional study.
Mm-hmm.
Question two was a cohort. For question three, we have a case control study. And then for question four, we had a systematic review.
All right. Good try. Who wants to go next? I guess there were three active groups. Mm-hmm. Yes,
Doctor,
Amari.
I was in a group with Kent Brian with our mentor, Dr. Jenna Bula. Our first
Mm-hmm.
answer was the cross-sectional study. The second, the randomized control trial. The third was a qualitative study. The fourth, a systematic review.
All right. Nice. Last group, group three, or I don't know the number, but yeah.
It was actually group two, Doctor. I
All
was
right.
with Frank and Riley.
Yeah. Good.
So for our first answer, we had a cross-sectional study. Second, we have a randomized control study. Third, we're actually arguing between case control and qualitative before the call started timing, and we just hurriedly crossed. And finally, we have a systematic review.
All right. Thank you very much. Thank you, guys. How was the experience? For you guys, I'm going to release the answers now. Who wants to read? Uh, yeah, who wants to read? I'm not going to call names. I might be wrong, but just read what I wrote.
Can I read?
Yeah, go for it. Go for it. Yeah, go for it, Kelly.
Uh, Match each question to the best study design. Number one, how common is hypertension in adults in Boya? The correct answer is cross-sectional study. It is best for estimating prevalence at a point in time. Does SMS reminder improve ART adherence? The answer is randomized control trial, best for testing effectiveness and causality of an intervention. What
Mhm.
barriers stop women from attending ANC? The answer is qualitative study, e.g., interviews, focus groups, to understand experience, perceptions, and barriers.
Mhm.
The last one, what does the literature say about telehealth for diabetes outcomes in Africa? The answer is systematic review with meta-analyses if studies are comparable to synthesize all available evidence.
All right. Thank you very much. So, don't unmute, don't mute. Do you contest any of the answers? Hello, Kelly. Kelly has frozen. But
No,
it's okay. Does anyone contest the answers? Now we are open for discussion. Yeah.
Um, okay, doctor, I have an issue with number two, randomized control trials. I
Uh,
understand that the SMS was an intervention, but I was thinking that maybe randomized control trials were more for drugs, where you could be doing blind, you could be doing double blind, single blind, all of that. So I was trying to
mm,
understand how, if you're going to be giving SMSs, how are you going to blind the study? I was not really getting how it could be a randomized control trial.
all right. Does anyone in the group want to? explain why we think two is a randomized control trial. Thank you very much for asking it there. That's a very nice question. Does anyone want to answer the question? Hello, 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 hello. I mean, most some I think it's Darren and Afai, your groups said randomized control trial, no? Hello, guys, you have to back up your answers. No one wants to take the floor, guy. It's okay. It's okay. It's not a court, please. I don't want to call names, but yeah. Anyways, it's a randomized control trial because SMSs are also an intervention. And blinding it's done by the researchers. Blinding and randomization is done by the researchers. So, or the research team. When you're blinding, the people assessing don't need to know, right? So there are ways to go about it. So when you're designing the study, you're going to have people who receive an SMS and people who will not receive an SMS, or people who would receive an SMS with a particular message, which is a message that is probably asking about adherence of ARTs, and people receive an SMS which is just saying, "Hello, how are you? I'm your doctor," you know. So that's how we do it, and that's really digital health intervention research to assess mobile health interventions like SMS, and that's how they've done it in many other countries to assess. And that's why some people now have it included in their care plans for people who have chronic diseases like hypertension and diabetes, that they receive messages from their doctors because they did research and they gave messages, and they actually gave a type of messages that encourages patients to stick to their medications. So it's something that we can also do in Cameroon, but um, we will need a lot of clearance for that. But yeah, thanks for the question. So we are coming to the end, so let's be snappy. Um, the next part, it's a brainstorming part again. I'm going to send you guys back into your breakout rooms, but again, randomly, so you might be paired to somebody that you were not paired. But the idea here is for you to just think. So I want somebody that has not spoken since the start of this call. Mm, who is that? I think everybody has spoken. Right. Let me see somebody that has not spoken for a long time. Bryant. Bryant, you have not spoken for a long time. Bryant, can you hear me? Unmute and read the slide.
Hi, doctor.
So
Practical activity, the second one. Write
um,
your
there's some echo in your background, so mute one of your devices.
is it okay now?
Either decide to
Let
mute
me
your
just
laptop.
let me leave. I think it's okay now.
Yes, it's okay now.
Okay. The second practical activity, write your topic in one sentence, convert it to PICO or PO for qualitative exposure. Example, using the PICO, P for adults with hypertension in SSR, I for community health worker support, C for usual care, and O for BP control or adherence.
Yeah, so thank you very much for reading, Brian. So this is an example of how you coin a question for a systematic review. So P stands for the population of interest. So here we are assessing a question with this example was assessing adherence of medication. So people who have hypertension. And so we ask ourselves, who is our population of interest? Adults with hypertension in sub-Saharan Africa, SSA. What is the interventions? We want to use community health workers. So we'll have community health workers who come and support people to remind them to give medications and not SMS in this case yet, because we are not sure that everybody has a phone. And so, and then we compare it to just usual care. So you come into the hospital every month to come and take your medications. And what we are going to assess as success is the outcome, which is a BP control or adherence. So we might say how in 1 month, how many times you take your medications and how well was your blood pressure control. So that's how you coin the question. And the question, the idea is to, the question we'll ask here is is the use of community health worker improving adherence for people living with hypertension in Cameroon or sub-Saharan Africa in general. And so we are going to do a systematic review to assess that. So now I'm going to send you guys to your breakout room to think of a topic like this. Eh? Think of a topic like this. So this is learning by doing. Now, you are not supposed to come up with a topic you're going to use as a magic review for. You have the entire this week to discuss with your mentor and come back to us to build that topic. But this is the first place for you to think out of the box. And you're going to have 5 minutes to do that with the person you're going to be in your breakout room with. And then after 5 minutes, we'll come back and then we'll wrap up the lecture. Does that sound like a plan?
Yes,
Once.
doctor.
It does, doctor.
All right, guys. I know this is already 1 hour in plus, so bear with me. We are rounding up. So, let's go into our breakout rooms. So you're going into your breakout rooms in the next Welcome back, guys. Hello, 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 hello. Hello, 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 hello. All right, guys. I guess everyone is back in the room. So, how was the experience? Who wants to share? How was the experience?
Evening, doctor. The experience was really nice. It was really, really nice. I had my own research topic in mind, but just from hearing what my colleague said, I was just amazed. Wow.
That's the spirit, guys. Okay, good. Who else wants to share? How was the experience? What was the experience? What was the experience?
It was from good evening, doctor. For my end, it was equally quite interesting. I got to look at my research topic equally in a different light, trying to formulate this people-related question. So it was interesting.
All right, nice. Good. So, any other person wants to share how the experience was? Hello, 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 hello. What am I missing? Kelly, Kelly, Lydia, you guys want to share your experience? How come you guys were in the same group? Oh, sorry. All right. Hello, hello, Kelly, Lydia, can you hear me?
Uh, yes, doctor. The time passed by so fast. In fact,
Oh,
we're still even contemplating on what to settle for our topic.
all right. That's okay.
Yeah.
That's fine. No worries. You don't have to settle on the topic on this call. But so the idea for this was to get you guys thinking and to see if you can already start applying the knowledge we've been talking for the last 60 minutes or so. But I hope you appreciated it. So now we're going to have a quick fire round on what we're going to be doing. So welcome officially to systematic reviews. So we've discussed how what research is, defined it, how people think about research, how researchers should think from an uncertainty to a question, to a problem. Then how to go about the research in the various methods, primarily and secondarily. We've reflected on our own ideas on problems that are around the things we're doing. And now we're coming to that why we in this mentorship will focus on systematic reviews. We've understood why we should do that. But the reason we are doing this is because we want to be able to generate a more reliable summary of research evidence with a focus on the health question, just like what you just did. Okay, that's the idea. We want to focus on something. Now, we want to be able to reduce how every finding from every study can be assessed. Because when we look at one paper, we cannot just say this is true. We need to say, okay, this is true for many papers or for many people. And so that's why we're doing what we are doing, right? That's why we want to do it systematic because we don't just want to talk about one publication from a university student in Boya or from another one in Yaoundé or from another one in Douala or another one in Bamenda. No, we want to talk about research from a group of papers on a particular topic and we're able to say this is what it's talking about. And then if we put all of that together, we should be able to say, okay, maybe this is what they should do from the research, what it's saying, so we can inform clinical practice, guidelines, and policies. And also now identify, most importantly, because we want to stay researchers with SRA or independently, we want to identify evidence gap for future research. So, guys, that is why we are doing what we are doing. And that is why I am going to be clinical, diligent to ensure that you get the best form of training to build this evidence. It is not just about us, it's about you, it's about the Cameroonian people, the Africans, whose data is less represented in clinical guidelines that we use, in policies that they use. We want to be able to generate that evidence. So, guys, this is what you're going to be doing in the last 11. Do you feel excited? Does this mean something to you? I want to hear you guys say it means something to us. Unmute and say it means something, or it doesn't mean. I want to hear it.
It does mean something to us, Doctor. Something to me particularly, it really means.
All right. Okay. Okay. All right. I hear you guys. So then let's do this. Okay, let's do this. And how are we going to do that? The methods, it's quite simple, right? Moving forward, guys, you're going to refine the questions. Okay, we are going to build it and then we are going to register your protocols. Everything we're going to do is going to be registered. We are going to do that. We are also going to learn how to do a comprehensive search of databases. We are going to assess how to review. That's why all of you are paired with mentors, because your mentors are going to be ideally your first reviewer. And then if the studies are too many, we can find a third person. Then you're going to learn how to extract data on standardized forms. You're going to have sessions. We are going to work on that. And then we're going to assess for bias in those studies. Okay. And to assess for bias in those studies is a whole journey, and it's going to be a dedicated session as well. And now we're going to say, okay, how do we discuss the findings? And that's where we learn how to write, how to discuss, and everything. And then we're going to report using the Prisma flow or the Prisma statement. I already shared this with you guys, but I'm just going to show you what the Prisma flow looks like. But this is the package we have, and we must achieve it in the next 11 weeks because this is week 1 already. So, do you think you can do this? I want to hear something. Do you think you can do this? Unmute and say, I can do it or I cannot, you know?
Yes, I
Can
can
do it,
do
Doctor.
so.
Okay. Okay. So, good. So, we are going to do this. And that's what the future looks like for us. Now, before I show you guys the assignment, let me switch so that you guys see what I shared with you guys and people have not looked at in their documents. Yes. So here is the Prisma flow. And by the time your manuscript is ready, we are going to make sure that it checks all of this. And this is what we are going to do with this. We are going to follow this as much as possible. This is already in your Bible, which is this one. It's already somewhere here. This is it here. And that was what I asked you guys to just read through after the last session. But this is it. So it's good to see what we are doing. It's good to see that we are following guidelines and things like that. So guys, that's it. But now, what do you have to do between now and next session? It's what I want to share with you guys now. And then we close. So Patrick, can you read the screen for me? Patrick, internet has not been kind on you. Can you read?
Okay, Doc.
Yeah,
Actually, the internet hasn't been kind with me.
yeah.
Okay, so your assignment due to next Saturday. Assignment one, draft your SR question. That is, submit a PICO PEO question with 5 bullet inclusion criteria, including population settings, study designs, outcomes, and time frame. Peer review 3 colleagues' questions in bracket use a feedback checklist. Like, so what this builds towards, that pack 1, 2 dots, protocol plus registration ID plus search logs plus screening archive. And you are building a publishable SR step by step. And lastly, a topic summary, the question mark.
Thank you very much, Frank, for reading. So, guys, your this is your first to-do task, which is generate a systematic review question, and we've seen the Pico framework already. Um, in the forum, I'm going to in the email you're going to receive this how you should give feedback on everybody's question, and it's mandatory that you review three people's question. So, I'm sorry, this is going to you need to submit those questions in the forum by Wednesday because we can't do it Saturday. So Saturday will already be the next lecture, but we'll need feedback. So by Wednesday, so start begging your mentors. And this is built into your first pack of deliverables, which is the protocol, the registration ID, and how we're going to search. So this is building. And so the idea, like I said, we are building a publishable systematic review, one step after the other. So all we want you guys to think this week is your question, your question, your question, your question, and then from there we'll build it. So how are you going to present this to me and your mentor or to us and your mentors? It's that's what brings us to a topic summary. So high level, a topic summary, it's ideally maximum 2-page document, excluding the references, that simply gives an idea of your research topic. Okay, it has a clear title, an idea of the research topic, very short, the objectives, and how you're going to go about it. Yeah, the how for all of us is a systematic review with meta-analysis or a scoping review. So that's it. And then what it's going to change the relevance is going to have in science. So this is going to be a very short one pager. You can give us references from the 2 3 things you will read, but really it's not mandatory for us to have references, but we just want you to think on paper, write this, and we keep building on this. And that's how we progress. This document is going to be expanded into your research protocol. But this is the first step that we want you to do a topic summary. So with that said, I'm going to ask, do you have any questions on this? Because we are rounding up. Any questions? I take silence for no questions. So I move. So what I want you guys
So,
to
please.
go for it, Patrick.
Okay. Concerning the assignment to be done before the next class, are we to provide our systematic review questions following the PICO PO mode, or we are also supposed to write the topic summary? I
Yes.
don't know.
So on the topic summary is not what you send on the forum, yeah? The topic summary is what you're going
Mm,
to send your mentor and us, the one pager.
mm.
But you need to send your questions on the forum by latest Wednesday, by latest end of Tuesday, so Wednesday, because that is what is going to help your colleagues criticize you. And once your colleagues start criticizing the topics and giving feedback, it's going to help you to improve on your one pager. You need to send your one pager to us. The one pager is just so that we look at it and you send it to your mentor first before you send it to us. So we look at it and we see how to improve on the idea. By the end of the session next week, you might have better ideas and that can still change. It's not written on stone, but you need to start learning, getting the writing skill, how to write your ideas out. So that's it. What's most important is think of the question in the Pico framework, put it on the forum, and then everybody's going, your peers are going to critique it, and then we're going to review it. And then in the background, you're working on your documents, and your document should be ready by Saturday because your mentor will have to look at it, and then we also have to give feedback on it. But this is going in parallel. Do you understand?
Okay, understood. Thank you.
Okay. So present your assignments on the forum. So by assignments, I simply mean your questions, right? The questions, present it in the forum by latest Tuesday. And then I expect everyone, all the mentees, to revise at least three other people's comments on that by end of Wednesday. And then we'll start looking at it Thursday, Friday. And again, please don't miss a class if you're going to be late. watch everything that we share, and notify your class representative if you're going to be late for any lecture ahead of time, please. And at the end of the class, you're going to tell us what you're going to learn, what you just learned on WhatsApp. And it's simple. Name and your name and the top three things you've learned. That's all. Hey, hi, Sincere. Thank you very much for the session. I learned 1, 2, 3. That's it. And then you can also say, I'm going to drop this in the WhatsApp group, but you can also say, on a scale of 10, I read this lecture. So, I mean, it's not for you to lie to me, but if it's very valuable, say it. If it's not valuable, say it too. So this is important for us to know how we are going to improve and give you the best. So that's it. So at the end of this session, all of you guys are going to comment on WhatsApp in the WhatsApp group. And then with that said, are there any questions? Do we have any questions, any worries, any challenges? Anything that was unclear over the last hours? All right, I'll take silence as a no, and I'll complete my slides and stop sharing. And so this is a fun part of the day where we have our family selfie. So guys, turn on your cameras for a goodbye selfie, and I'll see you guys in the next session. Hello, 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 hello. Turn on your cameras, turn on your cameras, turn on your cameras. Turn on your cameras, turn on your cameras, turn on your cameras, turn on your cameras, turn on your cameras. Doctors on call, turn on your cameras. Doctors on call. All right, thank you guys for going through the session, and I hope this was valuable to you guys. You've seen the way the lectures run. So we have a little bit of knowledge, we apply it a little bit, and then we come back. So that's how we'll keep doing our sessions. If you have any challenges, let us know, Bert. So I'm going to take a family selfie. Please give your best smile. Smile, I know it's late. Give your best smile, and we're going to be taking a selfie in 3, 2, 1. Cheers, guys. One last one. Cheers. All right. So have a wonderful Saturday, whatever is left of it, and I'll see you guys next week. And let's keep talking on the forum. All right, guys. Bye.
Hi, everyone.